My name is Young Samanyika. I work as WASH Projects Manager in Amref in Malawi, and the Kaya Extension COVID Response Project happens to be part of the WASH projects. Currently, Malawi is experiencing the second wave of the COVID-19 pandemic. This second wave has come with much force and pressure as compared to the first wave. The first wave only had a cumulative figure of about 4,000 cases. But now with the second wave, we are actually over 28,000 cases. We had our peak in January where we registered over 1,000 cases in a single day. And at the moment, we have experienced about 914 deaths. About 95% of the 914 deaths actually occurred just in January, meaning that we had the worst period at that time. Due to this situation, government has instituted several measures to make sure that maybe the spread of the pandemic can be slowed down. This includes the limit of people coming to one place. The limit is not more than 50 who can come together for a certain activity, but government has also said that in all offices, government as well as private as well as non-governmental organizations, they should limit the number of people coming to work. So most of the people currently are working from home. The health system in Malawi has been greatly affected. Mostly that is due to limited resources. The bed capacity is not adequate and oxygen availability somehow becomes a challenge. Health workers are also facing a lot of challenges, mostly because of workload, which requires them to work for more hours than usual, but also availability of PPEs, which is crucial for them to be protected from getting the infection themselves. There are a lot of gaps in terms of availability of the PPEs. The other thing is that there is a general fear by the general public to visit the health facility because they think that health facilities are where they can easily get COVID-19. Amref Health Africa in Malawi, with funding from Global Affairs Canada through Amref Canada, has embarked on several activities to support the government of Malawi in responding to the pandemic, especially on the preventive part. Amref is conducting several activities. One of it is to train health care volunteers on COVID-19. What is it about, and how it is spread, and how it can be controlled. And these trainings will be conducted through LEAP, whereby the volunteers will be learning through using mobile phones. And in turn, these volunteers are expected to visit households, where they will be teaching the household members on how to prevent COVID-19. The other activity that Amref is doing is to conduct public awareness, especially to rural areas where information is hard to reach through mobile vans. And also we are using the media like radios. We have created a lot of jingles where they will be aired through some of the radio stations in Malawi to disseminate messages on COVID-19 prevention and control. Secondly, Amref Health Africa is distributing infection prevention materials that will assist people to prevent COVID-19. These include hand washing facilities, soap, chlorine, and face masks, especially for volunteers, so that they use as they will be visiting the households. Through this project, the Kaya Extension COVID-19 Response Project, we expect that at the end of it, the public will have enough knowledge with which they could be able to take the right decisions in preventing the pandemic. With that, we hope that if a lot of people are taking the right procedures or behaviors regarding COVID control mechanisms, it will assist greatly in reducing or even eliminating the pandemic